I know there's a lot of dudes out there who are wishing we'd still be in a lockdown so they didn't have to do Valentine's. Well, guess what? You're back on the hook. I mean, you can still always play I'm just not really, don't really want to go out there, babe, because it's still the variant. There you go.
Chris
variant.
Chris Barnett said to stay home, so I didn't do anything.
I didn't know. Yeah, he said stay home, babe. What am I going to do?
And then she's going to say, you didn't listen to him for the first 8 months.
712, Dr. Hoa Nguyen, the chair of the Physicians Advisory Group. I'm just trying to help my fellows out there. Good morning, Doc.
Good morning, guys. Morning, Chris.
Morning. Let's just start right at the thing that everyone was sending around that Dr. Shea sent to like 5,000. Man, I want that guy's email list. He's got everybody's email address. So this went around in all of the chats. It went around on email. I think Dr. Shea had emailed the governor kind of a courtesy email as if she doesn't get these CDC guidances. And he wrote, Dear Governor, for your sincere consideration, CDC vaccinated persons, no need quarantine. Please follow as we have always referenced the CDC. And then basically this guidance from the CDC, which it just came out Wednesday, I think, stateside time. It says fully vaccinated persons no longer required to quarantine. Let me just read this off. I'll read you this little section so we don't take it out of context here. Updated quarantine recommendations for vaccinated persons. Fully vaccinated persons who meet criteria will no longer be required to quarantine following an exposure to someone with COVID-19. Additional considerations for patients and residents in healthcare settings are provided in that guidance. So, Doc, I know you got this probably like 5,000 times yesterday. But just tell us where we're at. We did get a statement from Dr. Cabrera, and I'll go ahead and read that off real quick here. But it was funny when Bree and I were in the office yesterday. People kept sending it and sending it and sending it. And I was like, let me try and get Dr. Cabrera on. But I don't think he's coming on this morning. He did send this statement, though, which you guys saw on the news, I know. Requirements and protocols are status quo as we review this very new recommendation and how it would translate locally. So, Doc, how do you think this new recommendation would translate locally?
Yeah, my phone ring off the hook yesterday. Yeah. Anyway, but, the CDC new guideline yesterday kind of shocked everybody. It's really really fast. Our immunization just started about 2 months ago. And really, if you read that closely, it's like close exposure to COVID-19. It's exposure. So basically, it didn't mention anything about traveling from one country to the next, or it's just really more likely just a close contact or someone being exposed to at home, at work, or whatever. But the travel exposure is a totally different thing. I think that still very new. CDC put a lot of guideline out there that truly is the local public health that will make the determination based on different criteria out there. So I think that we have to be very careful on the new CDC guideline. Remember, it's a guideline, but it's really depend on the local jurisdiction that make the final determination to go with the guideline or to be cautious on the guideline.
Right.
With the new variants out there that the UK, the South Africa, we really have to be careful on the travel guideline for people to come off island. I think that that guideline, I'm not sure going to be followed by everybody around the globe or not, just in the U.S. Other territory, other country around Guam, like Japan, Korea, and Taiwan, I'm not quite sure they're going to follow the CDC guideline or not.
Right.
Just because, like I say, it's pretty new. I think that we have to be cautiously look at it. take about another 2-3 months to see if anything changed, because CDC put guideline out there, and they're often changing after a lot of physician or a lot of provider, a lot of public health express a concern, and in the past, as you can see, they change. So I think if we just jump, like the letter just say Dr. Shea was putting out there, we will put our island in a position that it might have some surge for the new variants to come in.
Right,
Doc. So that's a long discussion we have at the PAC yesterday, and we all in agreement that hey, we got to be cautious looking at this thing and really not implement the new CDC guideline yet regarding travel quarantine in Guam.
So just to be clear, this CDC guidance, it says updated quarantine recommendations for vaccinated persons. Fully vaccinated persons who meet criteria will no longer be required to quarantine following an exposure to someone with COVID-19. So it doesn't really say anything about incoming travelers or anything, right?
Exactly. That's, if you look at it, you can read that article and then take it out of huge context, this thing. But
yeah,
for travel quarantine, especially on an island, is very important to do. So you really have to look at that thing and give it some time. So like anything new, you got to give it some time to see if the guideline change the next few months or not. So I think that we shouldn't jump, especially and the question last night is how do you prove someone that have been fully vaccinated? That's the number one. Right now, what we give to people is that little white card that you have, the CDC white card, that state the first dose and then the second dose with the lots number. But that card is very generic. People can probably somehow duplicate that card for very easily.
Right.
So you have to look at it real careful, because someone can duplicate a card give to you, and you take that by word of mouth. It's very dangerous. So like I say, different thing can happen. Right now, we try to do some research to see if any antibody tests out there that can be tested to make sure that you seroconverted after the immunization. That's the thing. I don't think that have the current antibody test would turn positive if after the vaccine. So I think still some serology tests out there that need to come up for you to prove that hey, my vaccination worked or not working.
So in other words, you still got to go into quarantine. Don't get excited.
No, don't get excited. so I don't think any member of the PAC reject that one. This is pretty clearly defined. So I think that our advice to the governor is no, we're not changing because that's CDC guideline, not yet.
Right, yeah. But, something that you guys may be changing and is the critical service worker exemptions. We talked, I think, last week, and you and Dr. Cabrera both said here on the link that because of the variant, we might be narrowing, and I think this was also covered in the public health oversight hearing, because of the variant, we might be narrowing who gets to skip quarantine. Right, with these critical service worker exemptions?
Yes, you have to be careful who you define as a critical worker, so that criteria probably will be narrowed down quite a bit. And also that we have to track and make sure that the essential worker, essential worker that allowed to do home quarantine and have restriction range of movement, that they do follow the quarantine guideline. They understand that they go to work, they go home, and they cannot go out to eat in a restaurant or do other stuff that they're not supposed to do. So we have to re-stress to them that hey, you are in quarantine. You're just allowed to go to work and go home. So those are the stuff that public health we need to monitor, make sure that the critical and essential worker follow the quarantine guideline and not to go around to place where they're not supposed to be.
What else was covered in the PAC meeting?
That's the majority of the stuff. So, Christopher, we're not changing the quarantine guideline because CDC guideline come out about the vaccination. Okay.
Sorry, Dr.
So
Shea. I mean, he gets to skip quarantine anyway, so.
No, he skipped quarantine anyway. So as much he does, but and
people were excited though,
the
right?
second thing is that we
Doc, I know people
people
were probably buying airline tickets yesterday when they saw this. They're like, "Oh, that's it. Let's go. Buy a ticket. We're going off island." Yeah, you can, but you're going into quarantine when you come back. Yeah. Okay.
I don't think you go to Japan, you're still gonna get quarantined. Korea and Taiwan, you're still gonna get quarantined. So PI included. So it doesn't matter if you're vaccinated or not. But the other one is very important. We had to kind of push forward and we're talking about sports for the kids in school. I mean, it's been a year now that kids have been at home and really they become very sedentary. And I think that with the current situation we're in, I think if you have a minimal contact sport like soccer or volleyball, and track, they should be allowed to participate and start doing some activity, because I tell you, the comorbidity for our population to be sedentary at home for 1 year is detrimental. So the kid got to be outside doing sport. You have to put guidelines out there for their safety and protection, but they should be allowed to participate on the minimal contact sport. Say tennis, soccer, volleyball, track and field. Those things are very safe. I know certain schools already have some practice. I know some, like St. John, when they practice outside, they still wear masks when they practice, but they should be allowed to start the program and be active again. Like I said, it's been a year, almost a year. So it's important mentally and physically for the kids to be active. So we really highly recommend to GDOE superintendent and the public health and the governor to really consider to let the kids start the activity again.
Right. Well, I think now they can do practice, right? But they can't compete against each other.
Yeah, they can do sport. And to me, like I say, spectator, just like in anything else in college football or, NFL, that, maybe you put one parent there during the games, allow just one person per player to be there to cheer the team or something. But you can restrict the crowd on those things, but they need to go back to be active.
Right.
So but
how do you kind of Doc? How do you kind of like balance that though? Because Joy had a good point here in the comments. Students, for the most part, aren't able to get vaccinated. So we're talking about competing against each other with no masks. And is that a concern? And if so, what are we doing about it? If not, please explain.
Again, I know students are not vaccinated, and I know Pfizer is below 16, you can get vaccinated, and Moderna is 18. But again, as the parents that usually give to the kids, and we vaccinate the parents, and we do our the 3 to 4W right now that we've been doing the past 10, 11 months, and the infection are down in the community. Again, the kid can participate again with things like wearing masks. They still have to do if they're not on the court, and like I said, restrict the spectator to one parent per player. Those are stuff that you see that is done in different country and is safe still. Again, this outside is outdoor. They run around, practice outdoor. We encourage people to go exercise outdoor. The soccer and the volleyball, they really have minimal contact. Remember, you got to be very close. If you do wrestling or something, yeah, I wouldn't do that because you are so close and you have a lot of contact. But like I say, different sport have different exposure. I don't think they have anything. I know Dr. Berger pushing with this thing a whole lot on like soccer, all that kind of stuff. There's no case that document any type of outdoor sport that will be, infectious to other kids, or to other players. So I think that they're very safe. Like I say, you got to balance um, different things here, and I think a year for the kid to be just in the house and not being active
Right.
is really detrimental to their physical and and the psychological
Right.
thing. So you got to make them active.
Right, and I mean, Doc, it's not just that they haven't been able to play sports; it's just also that they haven't had the social interaction. So there's a bunch of different factors that are affecting
Yes.
these kids, and so by doing things like allowing them to play the sports, I can see that we're trying to chip away at a lot of these
Hmm.
issues that are facing the kids. Because you're right, it goes back to their not just their physical well-being, but their mental well-being
Yes.
as well.
Yeah. And you can
Hey, but
different
Doc,
team.
the
You can
chess
just
team is
like you
ready to
can
go,
bubble
though.
them. Yeah. Huh?
The chess team. I don't know. Are we doing chess, guys? They have interscholastic chess.
uh, do we have chess for? I
Maybe
don't
we could do
know.
like an
But
interscholastic online gambling app.
no. But that'd be interesting. But I tell you, they have to play. They really have to be
Yeah.
active.
Yeah.
It's so. We really asked the superintendent and the public health and the governor to really consider that for the kids,
Right.
to start their interscholastic sport, so that way they can socialize and be active and be healthy. I tell you, diabetes is again is number one things in on the island, and they start at a young age, so we got to make sure that they remain active.
Right on.
Okay,
Doc,
so
anything on Valentine's Day? Are you guys expecting a surge in 2 weeks because of Valentine's Day?
we've been through Christmas and New Year and everything else, and our island's still doing very good. The car score is still low,
Right on.
so I think we are doing okay. We also asked public health to really put together some tracking, some chart for us to know that the few positive they are in the community, that they want to isolate and do contact tracing within a day or two. And so far, what they present, no, they are doing it. So hopefully the car scores remain low. But I don't think that anything will come out of Valentine's Day. We should be okay going forward.
Right on.
The other one, if people that expect is number two dose, um, I make sure they get number two. You can have up to 2 weeks late of your due date there, but don't miss the second shot.
Doc, and then we had Dr. Cabrera say that you could take the second shot up to 42 days after the first one. Are you guys going that wide or not yet?
We prefer not to, yeah, but it's 42 days mean that for that for the Moderna is 28 days plus 2 weeks. So that's as far as you can stretch out. There's 2 weeks after the due date, which is the 28 days. So that's 42 days. But that's as far as you can push out. But I would most of the clinic will call the patient, remind them of their second shot. If you don't have the reminder from the clinic, then if you can look in the back of your card, it should tell you the date for the second shot.
Right.
And you need to either go to the clinic or go to UOG and make sure you get the second dose. Like I say, don't be concerned if you are a few days late. You can get about 2-3 days earlier or you can get up to 2 weeks late, but don't miss a second dose. So try your best to remember that. So look in the back of your card. It should give you a due date there. Okay.
Doc, I know that. Are you still in the Guard or no more?
No, I'm retired.
He's retired, right?
23 years already.
Good.
Long enough.
Thank you. We had Mark Scott, the Guard PIO, on yesterday, and I guess we missed it the day of, but he was talking about when they open up the UOG vaccination clinic as part of Operation Liberate Guam. On earlier this week, there was a whole situation where Malomco were waiting for hours, right? And apparently he said they straightened that all out. But were you surprised by that, given how many vaccination clinics we've had, that, you know, we should have kind of maybe had this figured out by now?
Yeah, that should be figured out a long time ago. You know, to repeat things for Okadu for the long waits should not happen again. You know, but there's a lot of reason that day. I don't have all everything else, but I know there's might be some miscommunication with public health and Guard.
Right.
But the Manumco should be waiting for that long. You know, that's it's hard, and but that's where I think that a lot of things need to work out to make sure that things like that doesn't happen again. They should be owned by appointment now, so the minimal waiting time should be very minimal. That no one should wait more than half an hour or so. So again, we should do a lot of improvement. The Guard are doing an excellent job at UOG. I tell you, they do a beautiful job, and I listen to people that come and get the shot at UOG, and there's a lot of good comment on UOG.
Yeah.
So they should continue, and I think that hopefully that's a single incident that doesn't happen again in the future.
Yeah, Mark sounded very bothered that it happened, and it seemed like from what they were saying, it was really public health. I mean, they didn't throw public health under the bus, but it was really public health. It was like sending all these people over there at 1 PM, and they just got overwhelmed, and it was like, But he sounded, I like the way he sounded. If you guys want to check that interview, I'll go. It's on KUM News YouTube. But he sounded like bothered and offended by it, and he was like, no, we're just going to fix it, and it's never going to happen again, which is cool.
Yes. That's the mentality. They're going to fix it, and they're not going to happen again. Like I said, you can't ask for
moving forward, he said.
The Guard to do that.
Right
yes.
on, yeah.
So kudos for the Guard for doing an excellent job there at UOG.
Doc, thank you. Anything in closing you want to add before we let you go?
Okay. Get the second dose, and hopefully get on time. Don't be late. And still, even after second dose, make sure that you wear your mask, wash your hands, social distance. And if you're sick, still stay home. Okay. So and go see your doc. But please be careful, be safe, and have a happy Valentine's Day.
You too, Doc.
Take care, guys.
You too, my friend. You know, I wanted to bring Dr. Ann Pobutsky on to talk to you guys about chlamydia and gonorrhea. Because, you're actually more susceptible to catching those than COVID right now. So let me try and get a hold of her, Doc. Thank you.
Okay, bye-bye.
Bye.